Uncontrollable risk factors for heart disease. There are several risk factors for heart disease. Some you may manage, others you can't. Ones that can't be controlled include gender. Males are at larger risk. Age. A story of cardiovascular disease being postmenopausal still. Making some changes in your manner can prune your likelihood of obtaining heart disease. Manageable risk factors include smoking, high LDL, or bad, sterile, and low alpha-lipoprotein, or good, sterile, uncontrolled high vital sign, high blood pressure, physical inactivity, obesity, uncontrolled genetic abnormality, uncontrolled stress and anger. What am I ready to do to lower my likelihood of obtaining heart disease? Making fashion changes is also a tried technique. Whereas there are no guarantees that a wholesome fashion will keep cardiopathy away, it's going to really improve your health in alternative routes. Some risk factors unit related to others. So, making changes in one house can facilitate in others. Here unit some changes you will be ready to make. Quit smoking. Smokers have over doubly the likelihood of obtaining an attack as non-smokers. If you smoke, quit. Non-smokers administrative body unit exposed to constant smoke, like International Organization Agency, those that People United Nations Agency, settle for a relation who smokes, even have enlarged risk. Eliminating exposure to smoke is incredibly vital. Improve your sterile. Your likelihood of obtaining cardiovascular disease can increase as your total amount of sterile can increase. Your total goal have to be compelled to be however 200 mg per deciliter. Your HDL, the nice sterile, have to be compelled to be on the far side 40 mg per deciliter if you're an individual and higher than 50 mg per deciliter if you're a woman, and the higher the better. Your LDL, the unhealthy sterile, have to be compelled to be however 130 mg per deciliter. It's important to note that sterile values mean varied things to entirely totally different people. The excellence depends on your own odds of obtaining cardiovascular disease. Your doctor may use a calculator to help determine your risk. A diet low in sterile, saturated and trans fat, and simple sugars will facilitate lower sterile levels and decrease your likelihood of obtaining cardiopathy. Regular exercise can facilitate lower bad sterile and raise good sterile. Medications unit generally needed to attain sterile goals. Control your pressure level. Concerning 60 million folks within the US have high blood pressure, that produces it the foremost common heart condition risk issue. Nearly 1 in 3 adults has pulse pressure level, the higher number, over 140, and pulsation pressure level, the lower number, over 90, that is the definition of high blood pressure. Like steroid alcohol, pressure level treatment ought to be personalized, taking under consideration your own probabilities of getting heart condition. You can keep a handle on pressure level through diet, exercise, weight management, and if required, medications. Manage your polygenic disease. If not controlled, it will contribute to important heart injury, together with heart attacks and death. Management polygenic disease through a healthy diet, exercise, keeping a healthy weight, and medications prescribed by your doctor. Get active. Those that do not exercise have higher rates of death and heart condition, compared with people who perform even gentle to moderate amounts of physical activity. Even leisure activities like horticulture or walking will lower your likelihood of getting heart condition. Most people ought to exercise half-hour every day, at moderate intensity, on most days. A lot of vigorous activities area unit related to a lot of edges. Exercise ought to be aerobic, involving the big muscle teams. Aerobic activities include brisk walking, cycling, swimming, jumping rope, jogging. If walking is your exercise of selection, use the measuring instrument goal of 10,000 steps daily. Consult your doctor before beginning any exercise program. Eat right. Follow a wholesome diet low in salt, saturated fat, trans fat, steroid alcohol, and refined sugars. Try and have additional foods made in vitamins and nutrients, particularly antioxidants. Get a healthy serving of plant-based foods, like fruits and vegetables, nuts, and whole grains, too. Weigh what you ought to. Additional pounds place vital strain on your heart and worsen many different heart condition risk factors like polygenic disease, high pressure level, and high steroid alcohol and triglycerides. Analysis shows that fatness itself will increase your odds of getting heart condition. An honest diet and exercise arrange will assist you change state and lower your probabilities. Manage stress. Stress and anger could also be related to a better risk of heart attacks and strokes. Use management techniques to lower your likelihood. Use relaxation techniques. Manage it slow. Set realistic goals. You would possibly need to experiment with some new things, like radio-controlled imagination, massage, tai chi, or yoga.